again. My name is Ubacha Makamersi and I'm your host for today as well. So today we're really going to be talking on a very sensitive topic and it's going to be lengthy as well. So I implore you to please sit down and listen. Pay rapt attention until the end of this video, because in this video we're going to be treating a very special topic and you're going to miss a lot if you just tune off or miss a few minutes. So today we're going to be talking about hormonal imbalance. On special request, I've been asked to say something about this particular topic. So if you have something else you want me to talk about, don't stress yourself. Just kindly drop a comment stating the topic you want me to talk about, and it's all yours. Okay, so before we just jump into the particular thing, remember I told you that this topic was based on someone's request. So we're going to start from the rudiment. Actually, the main thing for today is supposed to be hormonal imbalance as it navigates towards the reproductive system, actually the female reproductive system. But we're going to start from the rudiments so that you can understand exactly what I'm going to be talking about. Okay, so that's why I requested for your rapt attention in the first place. Now let's continue. So hormones are your body's chemical messengers, okay, in such a way that they are produced in the endocrine glands. They are powerful chemicals that travel around your bloodstream and they tell the tissues and the organs what to do. So they help to control many of your body's major processes, including your metabolism and your reproduction. So now when you have a hormonal imbalance, it means you have too much or too little of a certain hormone. So even tiny changes can have serious effects throughout your whole body. Okay, so now let's take for instance a cake recipe. You know how troublesome it is to make a perfect cake for those of us that are not professional cake bakers. If you miss a certain recipe, then it could affect the cake, or if you miss a certain ingredient, it could affect the cake. That's the same way it happens in your body. So the endocrine glands could get the recipe wrong. Okay, so that's just the same process to the body as well. So now let's move on to signs and symptoms of hormonal imbalance. Then your hormones may actually play an integral role in your overall health. Okay, so these signs and symptoms, they range as a signal that you have hormonal imbalance. It doesn't mean that if you have these particular signs and symptoms I've talked about, it doesn't mean that you have it. No, that doesn't mean so. But just listen in case maybe you could have or possess like 5 or more. So these are the common symptoms of hormonal imbalance in both men and women. So we have weight gain, a hump of fat between the shoulders. Then we have unexplained and sometimes sudden weight loss. Okay, then you have fatigue, you have pain, muscle weakness, you're feeling sore, muscle ache, muscle tenderness, all the time. Then you have stiffness in your joints, you have swelling in your joints, then you have increased or decreased heart rate. Okay, then you have sweating, then you have increased sensitivity to cold or to heat, constipation, frequent bowel movement, frequent urination, and then increased thirst, increased hunger, and you also have decreased sex drive. Okay, then you have depression. You easily feel so depressed about anything, nervousness, anxiety, irritability. Any little thing someone does ticks you off. Okay, have blurred vision, infertility, brittle hair. Your hair easily breaks, your skin always so dry, puffy face, puffy under eyes, then always very swollen or rounded face. Then you begin to have pink and purple stretch marks. Okay, remember that I said these symptoms are non-specific. If you have one, that doesn't mean then you have hormonal imbalance. It doesn't mean that. It's only when all these symptoms come in about 5 or more. Okay, so now let's talk about signs and symptoms of hormonal imbalance of females at reproductive stage. So we have PCOS, polycystic ovarian syndrome. So naturally your hormones change during stages of puberty, pregnancy and breastfeeding. For these changes to occur, it means that you have to actually go through these stages as a woman. Okay, then you have heavy or irregular periods, missed periods, stopped period, or a frequent period. Hirsutism, excessive hair on the face and chin. Remember, some women are like that. They have hair on the chest, on the chin, on the face. You have too much of acne. You have too much of hair loss, darkening of the skin, especially along the neck. Then darkening of the groin, darkening of the breast, even underneath the armpits. Then you begin to have skin tags, vaginal dryness, vaginal atrophy, pain even during sex too. It's also part of a hormonal imbalance. Then excessive night sweat, beg your pardon, headache. Okay, now let's move on to symptoms in the male. Testosterone plays a very important role in the male. If you're not producing enough testosterone, it means something is wrong. Okay, so you have a variety of symptoms of hormonal imbalance in an adult male. Okay, so the development of a breast tissue. When you see a man begin to develop breast tissue as if his boobs are growing, then you have erectile dysfunction. You have decrease in beard growth and in hair growth, then body growth, loss of muscle mass. The guy doesn't have muscle, he's always doing like a woman. Then osteoporosis, some kind of bone disease, bone weakness. Then you can't concentrate, you're having hot flashes and all that. So signs and symptoms of hormonal imbalance in children. Now both boys and girls, they start producing sex hormone during puberty. So many children also experience delayed puberty, but that doesn't mean they won't have a normal puberty. Okay, now for boys with hypogonadism, they may experience lack of development of the muscle mass. Okay, a voice that actually doesn't deepen, it might just mostly sound like that of a girl. Hair that grows sparsely, not more, just there. Impaired penis and testicular growth is just very small, doesn't grow big. Okay, then you also have gynecomastia. Okay, for girls with hypogonadism, this is what you'll be seeing: menstruation that doesn't begin, breast tissue does not develop. So quickly, before I move forward, let me just throw some more light to some areas I've been talking about. Now, if you could recall, for those in Nigeria, if you recall these two people, Aki and Popo, no offense, please, I beg your pardon. You will recall that you recall that they are, very smallish in stature and all that. That is not their fault. I know so many people laughed at them when they were coming up and all that, but they are a pure example of this case of hormonal imbalance. Okay, however they look and whatever they look like now is caused by a serious case of hormonal imbalance. Actually, hypogonadism is part of it. Okay, if you listen, their voices do not deepen, they don't even have that much, they don't even have facial hair, they don't have beards, I doubt. So things like that, the growth rate is not increased. So that's an example of hormonal imbalance. So whenever you see people who did not increase in height, who did not, develop like normal females or normal males, you know that that's actually a very serious case of hormonal imbalance. So it's not a period for you to laugh or a period for you to do one or two things, okay? So I was just using them as an example. No offense, please. There are many possible causes of a hormonal imbalance. So causes differ depending on which hormones or glands that are affected. Common causes of hormonal imbalance, we could have hormone therapy, medications during pregnancy, we could have cancer treatments like chemotherapy, then tumors, whether cancerous or benign tumors. We have pituitary tumors, eating disorders, stress, injury or trauma. Then while the conditions may actually be initially caused by a hormonal imbalance, so having these conditions can also lead to further hormonal imbalances. Okay, so diabetes type 1 and type 2, diabetes insipidus, hypothyroidism, and underactive thyroid. Okay, so for hypothyroidism or an overactive thyroid, that's another name for it. Then you have hyperfunctioning thyroid nodules. Okay, thyroiditis, hypogonadism, we've mentioned that before, Cushing syndrome or high levels of cortisol, congenital adrenal hyperplasia, which causes low levels of aldosterone and cortisol. We have Addison's disease, causes they are actually unique to women. So many causes of hormonal imbalance in women are mostly related to reproductive hormones. That's why I said this is what we are going to talk about today. So causes are menopause, primary ovarian insufficiency, which is also known as premature menopause, okay? Pregnancy, then breastfeeding, then PCOS, okay? Hormone drugs such as birth control pills. That's why you should be careful when you're on these pills, okay? Now, I mentioned diabetes insipidus and diabetes type 1 and 2. So I'm just going to drop a link here, and you can also watch that video if you want to know more about diabetes, because I've actually done a video on that before. So please kindly watch. Okay, so looking at what we've actually discussed today, someone might become worried, someone might begin to ask, okay, so how do I know if I have hormonal imbalance? Remember, I told you that these signs and symptoms are non-specific. I'm not saying if you have one or two of these symptoms, then you have hormonal imbalance. No. So what you need to do is go to the closest hospital to you, go to the nearest hospital to you. Of course, you should have your family doctor, so he should be able to know what to do. He's supposed to carry out a physical examination on you to ascertain if you actually have hormonal imbalance or not. I'm not giving you this information or creating this awareness to make you worried in any form. No. So please be prepared to describe your signs and symptoms, okay, along which how they have occurred, and tell the doctors the kind of medications, vitamins and supplements you've been taking or you are currently taking. Now, this is actually the mistake many of us make. I've seen this a lot. When we get into consultation rooms, we actually forget the main thing we're there to talk about or complain about to the doctor. We begin to tell the doctor stories of how things are happening and what not and what not. Even the stories of the witches in our village and all. Please, if you feel when you get into the doctor's office, you feel intimidated and you forget, kindly write down whatever you want to say to the doctor. It's not a bad thing, so that whenever you look at it, you'll be reminded of exactly what you want to say and what you want to tell him. Okay, so Please be prepared to answer questions because your doctor will question you a lot concerning this. Okay, you might hear him ask you, how often are you experiencing the symptoms? He might ask you if anything helps to relieve your symptoms from the drugs you are taking. He might ask you if you've lost or gained weight recently, if it has been sudden or not. He might ask you if you're more stressed than usual. He might ask you when your last period was. That's for the women. He might ask if you're planning to get pregnant. He might ask if you're on birth control pills. He might ask if you're having trouble getting an erection for the men. He might ask if you have vaginal dryness or pain during sex for the women. So depending on your symptoms and your answer, the doctor could suggest one or two or more diagnostic tests. Okay, then you could actually request to perform this test. It could be blood tests, of course. Then your doctor will actually send your sample to the lab for testing. Okay, hormones can actually be detected in the blood. Yes, so do not be upset when he says, okay, let me just do this. You could check your testosterone, cortisol from your blood. Then you could also do a pelvic exam. If you're a female, he could ask you to go and do pap smear or check for lump, for cysts, or for tumors. Okay, if you're a male, the doctor may also check your scrotum for any lumps or any abnormalities. Please don't be scared, don't become conservative. He can actually refer you to an ultrasound machine or for a scan. Okay, the doctor may request to get images of the uterus, the ovaries, the pituitary gland. Okay, so that he could actually be sure. Okay, sometimes you also have some advanced tests for this. All right, so you could have biopsy. Okay, you could have MRI, we could have an x-ray. Okay, we could have thyroid scan and sperm count tests and what have you. Okay, so please, if you are experiencing symptoms of a hormonal imbalance, not a time for you to be scared, it's not a time for you to be worried. Kindly visit the doctor and please cooperate with him so that we could find out what exactly is wrong with you. Okay, now let's move on to something else. So next off, we're going to talk about the treatment of a hormonal imbalance. So your treatment of hormonal imbalance could actually depend on what's causing hormonal imbalance for you. Now we have estrogen therapy. So if you're experiencing hot flashes or uncomfortable symptoms of menopause, okay, your doctor may actually recommend a low dose of estrogen put into your body. So be sure to discuss the risk and the benefits of hormone replacement. Okay, hormone replacement therapy, HRT, that is if you don't already have a provider. Okay, there are some specialty doctors that actually do this. Okay, now you have vaginal estrogen. If you're experiencing vaginal dryness or pain during sex, you actually may want to try applying an estrogen cream, a tablet, or a ring. So using this local therapy treatment helps to eliminate many of the risks that is actually associated with systemic estrogen that travels throughout the bloodstream to the appropriate organ. Okay, now you could actually shop for these estrogen creams in pharmacies or pharmaceutical company. So now hormonal birth control can also help regulate your menstrual cycle. So types of hormonal birth control, they include the birth control pill, birth control patch, and the birth control shot like an injection, the vaginal ring, IUD, intrauterine device. Okay, it may also help to improve acne and extra hair on the face and on the body. Okay, so anti-androgen medications as well. Androgens are the male sex hormones that are present in both women and male. So women with high androgen levels may choose to take medication that blocks the effects of that particular androgen. Okay, so these effects can also include hair loss, facial hair growth, okay, acne, testosterone therapy. That's the next one now. So testosterone supplements can actually reduce the symptoms of low testosterone in men. In adolescents with delayed puberty, it actually can stimulate the start of puberty. That's if it delays. So it's given in many forms. It could be a patch, it could be a gel, it could be an injection. So thyroid hormone therapy, if you have hypothyroidism and the synthetic thyroid hormone level, okay, so this synthroid, it can actually bring hormone levels back to balance. It balances them. Okay, remember we're talking about hormonal imbalance. Another one is a medicine they use for diabetes type 2. Okay, it could actually help to lower that androgen level and encourage ovulation. That's for women. Don't do self-administration except if your doctor has asked you to do so, because some drugs have serious side effects. They might increase your blood pressure, they might make you start feeling nausea and give you heavy headache. So be careful on how you use them. Okay, so use what is prescribed for you by your doctor. Now, before I go further into the main thing we actually wanted to discuss today in this video, let me quickly say this. We have so many herbal and so many natural products, as they may call it, that have actually stated that they could control your hormonal levels or restore you back to premenopause, or restore your menstruation back when you've already entered menopause. Please, I beg us all these things they advise, especially in Nigeria here, it has become too much. It is something that medical professionals or medical practitioners, health workers have to actually act on, because it's becoming a serious issue. Most of them are not educated. They do not even have the slightest idea of what they are talking about. Okay, so please, I know that most of them are efficacious actually, but let's be careful on what we use and how we use them. Okay, now there are ways that you can actually naturally balance your body. You can regulate your hormones. Exercise is one of them. Eating a healthy diet is one of them. So by the time you just apply these beautiful lifestyle changes, then you'll be good. For the women, if you've seen that you can actually have you have the tendency to get fat more than others, then you work on your body with exercise, you work on your body with healthy diets. Eat a balanced diet. It's an important part of overall health. Never overlook this. Okay, decrease vaginal discomfort. Okay, you make use of cotton pants, not nylon pants. Apply some jelly or things that will cool there. Don't use scented douches. Okay, use warm temperature water to wash off that place. Don't use soap. Okay, then remove the excess hair around there. Then be careful, don't just apply um all these creams like Vits to remove hair on your private parts. No, that's wrong. Just do it the normal way and make sure you keep that place neat and clean. Also keep your body neat and clean. General cleanliness could also help you in a lot of way. Remember that when your skin pores are clogged with a lot of dirt, it will not allow normal secretion and excretion process to continue. So it makes you dirty, it makes you smell and all that. So please take care of yourself properly. All this actually is one of the ways we can control hormonal imbalance and hormonal changes. Okay, so actually there's a very big correlation between acne and hormonal imbalance. Okay, menstruation could also be a trigger for acne for most women. Okay, whenever they're in their period, that is when they have acne the most. Okay, so some dermatologists will say, go test yourself, let's know what your hormone is all about, let's know how your hormones should relate and all that. But that shouldn't be a problem. Okay, that shouldn't be an issue. Okay, so now we are going to look at fertility and infertility as it pertains to hormonal imbalance. Okay, so remember that we've established the fact that hormone imbalance, okay, means when a body has too much or too little or out of sync of a hormone. Okay, remember that. Or when the production of a particular hormones or hormones that are important for regulating the bodily processes are just very small. Okay, so the balance or the proper balance of hormones is actually essential for efficient reproductive cycles, such as ovulation process in women and overall system of conception. Remember that this is actually what we're supposed to talk about today, but I just did it so that we could understand what hormonal imbalance is all about. So hormonal imbalance is actually the cause of so many cases of infertility in today. Remember we talked about PCOS, polycystic ovarian syndrome. Okay, now we have so many disorders that affect their fertility level. We have testosterone levels and all that. We've discussed about that. Okay, so now the human body actually uses 50 hormones to regulate different systems and bodily functions, such as growth, metabolism, temperature regulation. There are also a number of hormones that actually help regulate the development and the release of the female reproductive cells or the egg. So the hormonal imbalance is the incorrect quantity of one or more hormones in the bloodstream, and the timing of the hormones release is interactions with the hormones and ability to respond through cell receptors. That is also very important for hormonal imbalance. Now, an irregular balance of hormones is associated with reproductive health in one or both partners, which can make conception and pregnancy very difficult. So hormone imbalances actually cause infertility in women and men, but they are often treatable with different lifestyle changes and medication. So please, if your wife is not getting pregnant, you also as a man should be checked. Okay, it's just that hormonal imbalance in men is just like a less factor than it is in women. So now, how do hormones affect infertility? Hormones play a very pivotal role in female reproduction. So particularly, these hormones control the menstrual cycle in order for pregnancy to occur. So hormones in the body must signal and regulate the growth of an egg within an ovary, then the release of the newly formed egg in the fallopian tube, and the thickening of the uterine lining for implantation. So if the newly released egg is fertilized by the sperm, the development of the sperm, of course, is also regulated by hormones within the male body. Now, the resulting embryo will then travel to the uterus for implantation. It should actually be able to break that lining. So the irregular quantity of one or more hormones can actually delay or prevent any of the above processes from occurring, making pregnancy very difficult to achieve. Okay, this is just part of it. Okay, so it can actually delay pregnancy in a way, so men and women could actually have it. Now, some of the most commonly diagnosed conditions and hormonal imbalances are anovulation or polycystic ovary syndrome and hyperprolactinemia. So these conditions often result in frequent or absence of ovulation, which complicates an individual or a couple's ability to become pregnant. Of course, if you don't ovulate, you can't become pregnant. So symptoms of hormonal imbalance: sometimes hormonal imbalance is not diagnosed until an individual experiences infertility, which is the truth. So women may experience one or more of the following symptoms, then they begin to run to the doctor. Okay, remember we talked about the symptoms before, but this one is concerning fertility. Absence of periods or irregular periods, spotting between periods or bleeding between periods, very heavy or painful periods, increased hair growth on the face, the neck, the chin, the chest, and the back, okay, which is actually supposed to be for men, unexplained weight gain, constipation, and diarrhea. Okay, men are less likely to have a hormonal imbalance that contributes to infertility and delay in conception than women, but actually the truth is that they may experience it, and these are the kind of symptoms they may display: erectile dysfunction, okay, low sperm count, reduced body hair growth, breast tenderness, and overdevelopment of breast tissue. You see a man beginning to have big boobs, thinning of hair, or in the male pattern they don't even have hair at all. Okay, so it is important to discuss any of the above symptoms with a reproductive endocrinologist if infertility is suspected, or just discuss it with your doctor. That's just what this means. Okay, so testing for hormonal imbalance, we actually talked about that, but hormonal imbalances in men and women can actually be determined through simple blood or urine tests. Okay, where we have the fertility hormones, they look at the presence of a variety of hormones that pertain to reproduction, like the follicle stimulating hormone, the luteinizing hormone. You find out the potential causes of your infertility and treat it. Remember, I said hormonal imbalance is very treatable, and you don't be scared when you hear you have hormonal imbalance. Some men will begin to beat their wives because they've heard that the doctor said you have hormonal imbalance. How come? How did it happen? How manage? This is where you begin to pound your... Please stop doing that. Hormonal imbalance is actually very treatable. When you have lifestyle modifications, I've said it before, is treatable. You that is beating your wife because the doctor said she has hormonal imbalance, you could actually be the cause as well. Don't forget, remember that you could actually be the cause of this whole problem as well. So hormonal imbalance does not come from only the man or the woman. It can come from two. Remember, we also have blocked fallopian tubes, hyperprolactinemia, and other ovulation disorders. You could have erectile dysfunction, which is obviously from you. Let's look at menopause and fertility, where we have PID, pelvic inflammatory disease. This pelvic inflammatory disease, recurrent miscarriage, uterine fibroids, uterine polyps, okay, these are all as a result of hormonal imbalance. Remember that especially PID, I told you that PID, even from chlamydia, from trach, they can all result to PID because they've remained untreated for a long time and then they've entered your bloodstream. Okay, so most of all these untreated infections cause PID, and then they lead to hormonal imbalance. Then you begin to have a case of anovulation. You can't ovulate anymore. Amenorrhea, dysmenorrhea, you can't even menstruate anymore. When you menstruate, it's painful. Then you begin to bleed in between periods. All these things are correlated. So hormonal imbalance can be changed once again with lifestyle modification. So as women, let's learn to take care of ourselves properly. Let's learn things to do. Even if we want to use the restroom, let's look for places that are good enough for us to use. Okay, like this video, give it a thumbs up. Thank you so much. Thanks for watching. Bye.